Hi, this is Dr. Benny Xiao. Is your child becoming more and more nearsighted? If so, you may be wondering why. Is it due to genes? Is it due to nutrition? Having the right kind of nutrition, minerals, etc. that keep your eyeballs from getting more and more nearsighted? Is it possibly due to environment, the type of toys he's playing with, all the time he's spending on the computer, reading a lot, etc.? Frankly, it is all of these things, and if you're really wondering why, and if you're really frustrated, it may be that your doctor hasn't given you any clear-cut information about exactly what might be causing it. If so, I'd like to share a little bit about what some of the reasons why your child's eyesight is getting worse. First of all, it is important to understand that there are multiple causes for your child becoming more and more nearsighted, genes being one of them. However, since we can't control our genes, let's just focus on what we can control, and that's the environment and the things that your child does. First of all, I want you to understand that a child's eyes are born being a little bit shorter than they should be. Namely, when it's too short, you're farsighted. And what happens is, as your child is developing over time, when he is looking at something up close, every time he looks at something up close, he uses his internal muscle to focus his eyes up close. And when he does that, it creates little pressure spikes inside the eye that slowly causes the eye to stretch out and grow longer and longer. This process of elongation is normal, and it should stop at the point where the prescription is pretty much close to zero. However, in people who are nearsighted, this whole elongation process goes awry and grows too long. When your child is nearsighted, the eyeball, instead of having stopped elongating at just the right length, it continues to do so and goes longer than what it should be. Bear in mind that 1 little millimeter of excess elongation equals to a prescription of -3 diopters. That's pretty high. So it doesn't take very much for the eyeballs to become nearsighted. So now this whole process of excessive elongation, this doesn't usually happen if your child spends a lot of time playing outdoors. Not usually, not unless there's some severe genetic factor involved with it. So typically the problem, of course, nowadays is that our children are spending so much time playing with things up close, watching TV, playing computer games, reading at a relatively early age, very early age, and not spending enough time running out in the fields, playing outdoors, etc. So going back to the balloon analogy, if your eyeball is elongating every time you look at something up close, that means that it's going to do so excessively and will become longer and longer and eventually grows too long. One other thing to also bear in mind is the way your brain operates your eye muscles, the way it calibrates the movements and so forth. When you spend too much time up close, it causes the way that the calibration is controlling the eye muscles to be thrown off. And so basically your eye muscles no longer work accurately, and so your ability to focus between near and far, okay, going back and forth, think of it as your eyes as an automatic autofocus camera. If your autofocus camera can't focus back and forth between far away and up close, it's going to have, your pictures are going to come out blurry. So the same thing happens with your child's eyes. So one of the things that we want to do is actually train the brain so that the eyeballs and the eye muscles are now lining up and focusing more accurately so that it doesn't need to strain as much. And when it does so, then what you end up doing is you release and reduce the amount of pressure within the eyes that causes the eyeballs to slowly expand and elongate. The type of testing that is necessary to determine whether your eyes are working together properly as a team, this type of testing isn't usually done in most routine vision exams, and most optometrists and ophthalmologists are not well versed in knowing how to analyze this type of information to determine whether it's going to affect your child's prescription. So the only way for me to know whether I can help is basically for me to do the exam myself. So I invite you to ask yourself, are you concerned about your child's eyes? Are you concerned about whether your child is going to become more and more nearsighted, and what repercussions it may have for your child later on down the line when they get older? Bear in mind that when your prescription is really high, it puts you at higher risk for certain eye diseases such as retinal detachments, myopic macular degeneration, and so forth. So if these are real concerns of yours, I invite you to give me a call and set up a time for consultation. Thank you.